Hello, everyone. Welcome to today's webinar. We are so excited to be releasing a new blueprint for public health system transformation, and we're really pleased that you took some time out of your day to join us for its official release. I'm Melissa Sever. I am a senior advisor with the Public Health Systems and Services team at the Public Health Accreditation Board. And with me today is my colleague, Jason Orr, who's a researcher in the Center for Public Health Systems at the University of Minnesota. Before we get started, just a couple of quick logistical items. First, we do have a lot of registrants today, I think over 200. And so we have muted microphones in order to cut down on background noise. That said, we do encourage you to use the chat. That's available for you to interact with both Jason and myself, to interact with each other, and your fellow participants as we go through our webinar this afternoon. I'd encourage you now, if you'd like, to just please start by sharing your name and your org, just as a way to introduce yourself in the chat. We also have a Q&A feature, and that Q&A feature is available for any questions that you might have as well. So if you could toss your questions in Q&A, that kind of keeps it separate from some of the chat that's going back and forth in the chat box. We will answer some of your questions as we go, as we're able to do that, but we've also left some time at the end as well to address any questions that might be lingering from earlier in the webinar. I also want to note that the webinar is being recorded. You will, and it will be posted to PHAB's website. You will receive an email post-webinar with the link to the recording and then also a copy of the slide deck. And then also for those of you who may be interested, Zoom does have a closed captioning feature. So if you'd like real-time text display of the audio, just please click on the CC button, which you should see in the toolbar at the bottom of your Zoom screen. You can click it on or click it off. If you don't see it, if you click on that More button with the 3 dots, that should reveal the closed caption icon. So just click on that and you should have some text display. So this slide shows the topics that we will be covering today. We hope that by the end of the webinar, you will be able to describe what's contained within this new blueprint for public health system transformation, where to locate it, and then where you can access some of the other supplemental resources and materials that can support you on your transformation journey. Lastly, again, before jumping into content, I want to take some time to really acknowledge, I say a few folks, but many folks who really made this blueprint possible. So first, development was funded through the CDC, through the Public Health Infrastructure Grant. So they provided funding for the development of the blueprint. And then I also want to acknowledge the team at the University of Minnesota Center for Public Health Systems. Jason, of course, is on the call and will be co-presenting today, but the entire team at the Center for Public Health Systems for their support in the development of the blueprint. Also want to acknowledge my colleagues at PHAB, who you see listed here on the slide, who've helped from blueprint design to content to helping with the webinar today. So a big thank you to my colleagues at PHAB. And then also a shout out to our 21st century learning community representatives who really have paved the way for governmental public health system transformation and whose good work and feedback informed the development of the blueprint, with special acknowledgement to the 4 individuals that you see noted here on the slide who were gracious enough to review the new system transformation graphic, as well as the content of the blueprint, and provide some feedback. So clearly a collaborative team effort for sure. So let's go ahead and dig into the content. And I want to start by just grounding us quickly in the what and why of public health system transformation. So this slide shows PHAB's definition of public health transformation. And really, in simplest terms, it requires us to sustain what's working, building on what can be improved, and then really reimagining what could be so that all people in all communities can live to their fullest potential. And that transformation really occurs through a fundamental shift in the way that a public health system is structured and also how parts of the system function and interact. And it's facilitated through things like continuous quality improvement, innovation, collaborative partnerships, innovative community-led efforts, changes in policies, processes, governance structures. So really at the end of the day, the system physically looks and functions differently. So for decades, there have been significant efforts across government to revisit and revitalize the public health system. And so this slide shows some of the reports that highlight not only some of the challenges with our current system, and some would argue we really don't even have a public health system in this country, but really some of those challenges, and then also propose some national recommendations for how we can move forward together. One of the earlier documents is Public Health 3.0. You see that in the upper left-hand corner. This is the document, for those of you who've been around for a while, really defined public health departments as a community's chief health strategist. And then more recently, we've had reports from the Bipartisan Policy Center and the Commonwealth Fund, again, releasing reports with recommendations for both modernizing and strengthening our public health system. We've also had several reports that are focused on specific topic areas, such as workforce, like the Staffing Up report, as well as recommendations for modernizing and ensuring equity-centered data systems. So we know there are some states also, in addition to these reports, that have taken really intentional steps to transform and modernize. And I mentioned PHAB's 21st Century Learning Community in my acknowledgements. But 21C is a network of, believe it or not, 21 states who meet regularly to learn, to share resources, and to identify promising practices related to system transformation. And that 21C group has been around for many years, and they continue to meet on a regular basis to share their stories, their challenges, their best practices. I also want to note that for the first time, we have our non-categorical funding through the CDC Public Health Infrastructure Grant that is focused entirely on strengthening the public health workforce, foundational capabilities, and then also supporting data modernization. And it's really historical funding to focus on that foundational infrastructure for public health. And then lastly, I want to acknowledge too the current environment in which we're working. There is a lot of uncertainty. There have been a lot of funding cuts. I was on the front lines during COVID, and I often joke, I feel sometimes like COVID never really ended. We've just shifted from, one sort of crisis to another. And so we continue to exist and do our good work in a chaotic environment. But I also am a firm believer that as difficult as times like this can be and are, that there is always a window of opportunity in these moments that really forces us to think differently about the way that we approach and the way that we do our work. I was not at NACCHO last week, but I've heard from several colleagues that this idea of sort of reimagining, and that word came up in the definition, PHAB's definition of transformation, but that this idea of reimagining was a theme that came up throughout the conference. So we're really excited about the timing of the release of this blueprint as a resource to support that work. So one last sort of context setting slide. This continuum illustrates how transformation occurs. So when we think about system transformation, on one end of the spectrum, on the far left side, we can be thinking about those incremental changes that are needed within our current systems and structures to make improvements. And this is where quality improvement typically occurs. On the other side of the spectrum, on the far right side, we should really be asking ourselves what could be. This is where the reimagining comes in. If we were to take ourselves out of our existing systems and structures and how we know public health to work, what would we build? What would it look like? And what's the change? And it would be disruptive change, but what's that change that's needed to help get us there? Innovation we put in the middle because it's really critical to transformation across the spectrum or across the continuum, as we can't continue to do things, right, the way we always have, right? What's that saying? If you continue to do things the way you're doing it, you can't expect different outcomes, right? So innovation is critical to transformation. We need new and novel approaches to how we're structured, how we function, and how we deliver our services. So with that, we are very, very excited again to be releasing this new blueprint for public health transformation. And Lydia, if you want to go ahead and drop the link in the chat, please feel free to do so. The blueprint is intended to guide governmental health departments and their system partners through the transformation process. And again, it's grounded in basic system transformation theory, but with a little bit of a public health spin. So we feel that there's something in this blueprint for everyone. It can be helpful to public health systems that are maybe just dipping their toe into intentional public health system transformation efforts, as well as those states who have been engaged in this work, many for years. And while the blueprint is structured through the lens of really sort of state systems or state public health systems, um, really the blueprint can be very useful to individual health departments as well, who are thinking about modernizing or transforming their local public health system at their own community level with their public health ecosystem partners. So this slide actually shows the newly revised public health system transformation graphic, which again serves as the foundation of the blueprint. And the document is organized based on the phases and the cross-cutting concepts that you see here. So I see that Lydia's already dropped the link into the chat. So you are all the first to be seeing this new resource. It is hot off the press. And I'm now going to turn it over to Jason, who's going to orient us to the blueprint and share a bit more about what you'll find within. And again, we would encourage you to open the link and follow along with Jason. It might be helpful to do that and to listen to him. And Jason, I'm going to turn it over. The floor is yours.
All right, perfect. Thank you. Next slide, please. Yeah, well, I am very happy to be here. Public health system transformation is, definitely a core interest of personally for myself and, in our work with the center. And again, I want to acknowledge our staff from the Center for Public Health Systems that helped put this work together, the work from PHAB to also coordinate and put this document together. And again, those members from the 21st Century Learning community who reviewed the work that we did and assisted us with the messaging and whatnot. Today, I have only a short amount of time to discuss the blueprint. It's rather lengthy, rather technical, but what I'm hoping in these slides is to give you an impression of sort of what it contains, while, as Melissa said, digging into the blueprint itself, I think would be an excellent starting point as well. So the blueprint itself, we designed it as not necessarily a manual, but a guide to assist health departments really at any stage of public health system transformation. Many of the states that we would consider, say, maybe early adopters of the modernization work, like Washington, Oregon, Ohio, and others, it might be a little bit further along, beyond the initial phase of the assessment. And others of you might be sort of in the process of planning and trying to figure out, can we do this thing, this big thing that is public health system transformation? So the blueprint, we hope that it serves as a guide, really guides through the phases of system transformation. We'll bring that graphic back up next and really show that it shouldn't be really new to anyone, but just the depiction and what we included is different. Throughout the document, we provide questions to help you think critically about each of these different phases as you're working through them. Provide some recommendations for steps, suggested resources. We have a wealth of resources that we suggested for this. And we hope that it complements other system transformation resources, including, in addition to the blueprint, we put together an issue brief related to strategic communications alongside system transformation. So how to think about that internal and external communications while you're working on this very hefty system transformation work. And then a document called Promising Practices, which is really a one-page summary of what's in the blueprint. Lastly, what the blueprint does not do is, it's really not a detailed manual. Each state is different. Each process is different. What we were aiming to do is point you in different directions that might be helpful. We don't necessarily go into detailed guidance on how to follow recommendations, or really a lot of the more specific questions that might need to be asked. Again, it's aimed to point you in a direction. And it's not necessarily a comprehensive list of questions, recommended steps, or external resources. Again, it's to supplement your process. Next slide, please. Yeah, so the structure of the blueprint, again, here's the image that Melissa showed a couple of slides back. Many of you might recognize it's similar to the planning P. It's similar to other product or process design processes where there's some sort of a getting started. There is an initial assessment or investigation, figure out what is this thing, what is it that we want to do, what are our goals and objectives. The design and innovate phase. So taking that knowledge from that investigation and how do we plan, how do we construct, how do we put together what we need to do for this transformation work. Test and transform, this is where you actually implement the work, do pilot testing, phase in this transformation work, which expands the gamut from policies and practice changes, new staffing paradigms, all sorts of things. And then last but not least, evaluate the system. We include that in the blueprint, the evaluation piece at the end, because again, at the end of this large transformation or modernization process, you want to figure out, did this work in the way intended? I'll also note that we try to weave continuous process improvement and things such as developing metrics earlier in the other phases where they make sense, while focusing on a summative evaluation at the end. At the bottom, you'll see the cross-cutting concepts. We tried to break each of the phases into different functional activities or steps that you might take. So for example, your state might be looking to revise your performance standards or your services framework. Separately, you might be looking at governance paradigms, state and local, private, other things like that. Service delivery, where you might partner in delivery, or your health department might more or less be the independent deliverer. Human and financial resources, anything related to workforce, finances, other things to think about in how do we resource this system that we're trying to transform or modernize. Policy and legislation, things to think about in terms of little p policy, different practices, internal guidance, and things like that. And big P policy, legislation, and other things that will structure this newer revised system. Standards and performance measures, again, this aligns with the evaluate the system, and we try to think about standards and performance measures throughout the work. And last but not least, responsibility and accountability. So within each phase, who's accountable at, I guess, little a accountability in terms of specific roles, jobs, tasks within agencies, big A accountability in terms of who do you answer to, what is the governance of this process, and things such as that. And again, we suggest resources throughout and have a detailed annotated bibliography at the end. Next slide, please. Okay, so getting organized. This is the first section in the blueprint. This is where we figure for any process that's being done, before you take the step of starting to assess, starting to collect data, you really want to get organized. You want to determine your steering committee, identify what are the bounds of this process, what is our vision for this work, what goals do we have, and start bringing partners together, creating structures, figuring out is this system transformation process, this modernization, this work that we're pursuing, are we ready for it? Do we need to get state and local health departments, private partners, policymakers on board in advance of this? And we could talk in the Q&A or later in terms of what works best. What are ways that other states have kicked off this work and galvanized that activity. Next step. So phase one, assess the system. So after you've gotten things organized, you figured out who is doing what, what is our vision for this? The next step is really to figure out what resources do we have, what assets, what strengths or gaps do we have, what present roadblocks, what is the current status of the system that we're looking to transform? This can include things to identify, where are the places that we might need to focus effort. Um, for some states and local health departments and others, there might not be an understanding of what resources are in the system. So how many public health staff are in the state? Do we have enough? Um, and really starting that assessment process. We encourage looking at delivery structures. So every state is different. Public health is not monolithic. You've got states like Florida, where there's a centralized governance, and each local health department is an extension of the state. Or you've got states like my state in Kansas, where there is sort of a role that the state takes on. Local health departments have this decentralized home rule authority, and there's that autonomy there. There might be service and resource sharing up to and including regionalizations, mergers, consolidations. And there might be different forms of delivery structures within the state. And within this, it's investigating what facilitating factors, what impeding factors might be in play, and trying to figure out, what are our desired outcomes from this assessment to help inform the next phase. Next slide, please. So phase two, this includes everything after you've collected the data, you've figured out a little bit of the direction that you want to go, and this is sort of the now what. Within this phase, this is planning for what needs to be done. So this is doing strategic plans at multiple levels. This is organizing and coordinating with different public and private partners to figure out this is, from the assessment phase, this is where we're at now. And also this is where we'd like to be. And phase two is how do we get there? So identifying areas where, maybe we expand or add services either across the state or in certain jurisdictions, reconsider performance standards, think about the oversight and governance of public health, as well as who is delivering those services and in what structure. Thinking about, once we have these policies in place, these standards, this service delivery, what is staffing going to look like? What is resourcing going to look like? And who's responsible for that staffing and that resourcing? And last but not least, thinking about how can we pursue innovative approaches? How do we bring different health departments, public and private partners together along with this? And what do we need to know or have in place in order to implement this work? Next slide, please. Okay, so after we have put the plans in place, we figured out, okay, what is it that we want to do? The next step is doing the thing. So, I think testing is an important part of this. Many states, for example, I know for sure Washington, Oregon, and Ohio, and Minnesota have done little pilot projects in terms of, how can we change services in this approach? Review that work and see, can this be expanded or adopted, across the system? And this is really where that implementation comes in. So you take those plans, you take those policies that have been designed, the legislative package that might have been developed, and you try to pass and enact that legislation. You try to adopt and enforce policies. As you go through the process, you're working to identify, are there any facilitating or impeding factors? What is assisting this implementation? What might be impeding this implementation? And keeping in mind, level setting and working to assure that things are going off without a hitch. But then you're also collecting that information and evaluating as you're going through. Is this, working out at sort of a minor level? Throughout this phase, there is a lot of coordination across public and private partners to really move this ship, turn this ship in the direction that we're looking to go. And it involves engaging widely with partners and working with partners at all levels to assure that these plans are coming to fruition. Next slide, please. Last but not least, evaluate the system. As I mentioned before, we tried to weave throughout the different phases, considerations for developing performance metrics, thinking about facilitating and impeding factors, thinking about continuous process improvement. Mostly in phase 4, what we're trying to convey is, what is your summative evaluation at the end? You started out this process at the getting started, or the phase 1 of, maybe not having all of the information, maybe not having a solid direction on where you want to go. And throughout the next 2 phases, you developed your plans, you tried to implement those plans, and now we're looking to see, have we moved the needle? Have we moved in the direction that we're looking to, move for system transformation? Within this phase and even prior to it, it involves designing metrics, thinking about those performance standards, what changes have been made, and also thinking about trying to identify and implement corrective actions. So if something is not going according to plan, how do you address that? When do you address that? And how does that influence this summative evaluation? The last thing I'll say about this phase 4, if you look back at the figure and think about the planning P, this is a cycle. This is a process. We've laid out the different phases in the order that makes sense to develop a system. But once you hit this point, of evaluating the system, maybe it's time to go back, do another assessment, do additional planning, not necessarily like as big scale as you did for this overall process, but if things are not working out as intended, go back to the drawing board in terms of collecting data, planning, designing, testing, implementing. So again, this whole system transformation process is a cyclical process where you're going to be working through this planning P for each program, function, activity, things like that. Next slide. Okay, back to you, Melissa.
Thank you, Jason, for that overview. And we have a couple of questions that are coming into the chat or into the Q&A that we'll address in just a moment. But a couple of things that came to mind as Jason was talking. What I really love about this blueprint is, and Jason touched on the cross-cutting considerations. So those, things like governance, policies, the way that services are delivered or service delivery. So what I like about the blueprint is that for each of the phases, it looks at each of those cross-cutting considerations, and it helps the user think about, okay, what questions do we need to be asking? What are some resources that can help us as it pertains to, let's say, as we're assessing governance? And then also, what are some recommended next steps? So it really drills down not only broadly across those phases of system transformation, but across each of those cross-cutting concepts as well. So whether you're focused on governance or service delivery or policy or any or all of the above, I think that there's specific guidance for each of those across the phases. So I just wanted to highlight that again, because I think that's a really unique feature of the blueprint. So what's next? Just real quickly, I want to share a couple of things that are coming soon before we jump to the questions. And if you haven't had a chance, if you have a question, haven't had a chance to put it in the Q&A, please do so. We'll get to that in just a moment. But I want to share, again, some events and resources that are coming soon. So first, we are working on PHAB is building an interactive website as another way to share blueprint content in, I guess, it's kind of a less static format. So the website will be, we see it as organic, right? It'll be ever evolving. And then as new resources, stories from the field emerge, we'll add that as the work evolves, right, nationally within our states, and as we continue to learn as well. So it'll be a more interactive website. We are also planning a public health system transformation virtual learning series that we plan to launch in January of 26. It will be a 6-part series that will walk participants through the phases of the system transformation process. So the content will be very applied with the goal really for participants to walk out with what I'm calling kind of a plan to plan for system transformation. But because it's so applied and so interactive, space will be really limited. And so if you think you might be interested, you're going to want to probably register quickly because space will be tight. Registration is not live yet, but we wanted you all to have this on your radar. Because you've registered for the webinar, once the transformation website and also the registration comes out for the learning series, we will email all of you directly. It'll probably be 2 separate emails, but you will all be emailed directly as registrants. And then, of course, we'll also share through our PHAB communication channels, our newsletter, our social media channels, also through FIG communication channels as well. And then lastly, I want to just also acknowledge that we are here, PHAB is here to support public health systems with their efforts through training, technical assistance, consultation, facilitation. So please feel free to reach out to us using our TA email, fabta@fabboard.org. Even if it's just to have a discussion about where you are, what you're thinking, we can discuss your needs and how we may be able to assist. So with that, let's go ahead and move to some questions. And Jason, I will read the question. I'll take a first crack at it. And then if you have anything that you want to add, please feel free to do so. I would also encourage you, those of you that are participating, if you have a question, get that into the Q&A so we make sure that we address it. So the first question, how would you all answer when someone asks, what phase of the blueprint are we in? When the answer is sort of all of them, some more than others, and we're often looping back and revisiting phases. So Ellie, I kind of feel like you almost answered your own question, and Jason sort of alluded to this as well. You know, the phases, we show them in the graphic as being linear, but it really is a back and forth, right? You plan, you test, you transform, you may go back to planning, you may assess, you know, your service delivery structures, and then you decide that you want to go back and assess policies. So it's really an adaptable, it's not a linear framework. And I think, you know, I think that really truly is the answer. It's organic, and you can be in different parts of the phase depending on the work that you're doing at different times. So Jason, would you have anything to add to that?
No, I would say yes, perfect. And like you said, Allie, you might have answered your question. So, we had a challenge, our team, when putting this together, because we also recognize that while we are setting up somewhat of a linear process or cycle, we recognize that not everything is going to occur strictly linearly. I think in an ideal world, you would do all of your assessment at once, all of your planning at at once, following that, all of your testing and implementation, and you'd segment it. But for example, when we supported the statewide assessments in Minnesota and Illinois, due to scope and resources, the focus was on the human and financial resources, a little bit of the policy, a little bit of the service delivery and governance, things like that, but not necessarily everything there. And you might also find that there might be aspects of this work that do need a little bit more iteration. So you might be in the process of continually collecting data, making changes, and assessing things like finance, for example. Finance might not be something that a statewide system does all in one go. Maybe it's piecewise. So I think it's hard to say specifically what phase of the blueprint any given state is in. But I think if you think about what activities are occurring, where you might be in terms of, are you trying to design something or implement something or collect data, that might inform where you might be and what questions you might consider and where to think next.
Thanks, Jason. We have another question. Are there examples available of types of transformation occurring or potentially occurring across public health systems? So for example, in phase 2, design and innovate, is there a starting pick list of possible approaches to transform? So again, I'll start. There isn't a pick list per se in the blueprint. There is a list of recommended steps within that phase, test and or design and innovate. And I think too, it is really dependent upon which which cross-cutting consideration you're looking at as well. I will say that with the development of the website, our hope is that we'll continue to be able to expand resources, share case studies, stories from the field that might start to develop. I hear what you're saying, sort of that pick list. So if you're thinking about approaches to adapting your governance structure, what are some approaches that other states or other systems have used? So we can consider that, Leesky, of course, as a supplemental resource that we could put on the website. The only other thing that I'm thinking about right now is we do have a set of fact sheets for our foundational capabilities. And there is a list of recommended sort of changes that can be made to strengthen foundational capabilities. That's something that exists now that could be helpful in this work. Jason, anything to add?
Yeah, I think I'd just follow up. I think it's a good question. And you might remember in your work with the Center for Sharing Public Health Services, those resources are now with PHAB, that when thinking about governance and service delivery, cross-jurisdictional sharing and other things, there are some examples of how, those might be set up, how you might transform systems from that service and resource sharing standpoint. This was a challenge for us. So on the one hand, there are some examples out, particularly through the 21st Century Learning community on really more on the assessment side, piloting side, and I'd say sort of the evaluation performance metrics side. One challenge we had was really a lack of data and information write-ups on a lot of this. So we know that quite a few states have moved forward with systems transformation to a certain extent, but that doesn't necessarily mean that those within that process or within that work, say, wrote up a case study on what they were doing and how they did it and what thoughts and considerations they had. There are, I would say, fairly good examples of how to structure that assessment, like what questions were asked. There are some states, I'm thinking of Washington and Minnesota in particular, in terms of how they structured piloting work and putting some of that together, for, say, sort of the phase 2, phase 3 design and implementation or testing. But when it comes to the system transformation, this is a big, massive, multifaceted process. Again, our blueprint is in a manual, and we're hoping to point you in different directions. But again, it depends really on what your state or system's goals or objectives are, what is on the table or off the table, what has already been done or needs to be done in terms of, say, which of these functions, finance, governance, should be done. I think in our opinion, all of the different functions and all of the different phases should occur for system transformation to be successful. Like, I don't think that, for example, moving to change state funding formulas or other things absent other policy work or standards or changes to service and resource sharing would be successful. So fortunately or unfortunately, I think there are a variety of avenues for state and local governments to determine which direction to go.
Thanks for expanding, Jason. And then we have a broad question from Julia, and I would actually open up the floor to the participants as well, and you can pop your responses in the chat, because I'm sure we probably all have a perspective on this one. But Julia asks, I know this is a broad question with complex answers, but from your point of view, when you look at the US public health system as a whole, what are the most problematic gaps or shortcomings that you see? Funding, of course, comes first, right? Adequate funding. It's like the age-old public health issue, governmental public health issue. But I would, first of mind for me, and I would welcome Jason and again others, please, use the webinar chat to answer this question from your perspective. I think we're structured so differently, right? I mean, if you've seen one health department, you've seen one health department. If you've seen one state system, you've seen one state system. Um, and so I think it's challenging to think about really improving the health and well-being of the population as a whole until our public health systems are more interconnected. And I would say that would include our hospitals too, from a data standpoint and other community partners. But to me, that's a big challenge too. You know, we can transform our systems within our states, but until our states are interconnected better nationally, I think that's when you're really going to start to see improvements in public health, well-being and health nationally. Those are the first two that pop into my mind. Jason, I would welcome you to add your perspective, and then again, please use the webinar chat if others have other thoughts. It's a great question.
Yeah, I do think it's a great question. Yeah, unfortunately, I don't know how satisfied my answer will be. I, like Melissa said, would encourage others in the chat to do it. So when thinking about the U.S. nationally, and some of us in this area have tried to identify this, have tried to characterize this. Again, public health is not monolith. Some states are doing much better than other states. Some jurisdictions within the state are doing better than others. When thinking about the U.S. public health system as a whole, I do think that funding and finance seems to be the first thought for individuals, and for sure it's an issue. I think we are underfunding governmental public health with respect to, say, where we fund healthcare and other things. I would say if we're looking at the root cause, I think funding is an outcome. I think really working with um, communities and policymakers to think about the importance and prioritization for governmental public health. One thing our center is trying to work on, and I know others have tried to do this before, is the question on return on investment for public health. What particularly when thinking about population health, how are investments in population health prevention, how do those pan out? What unit of investment leads to a unit of outcome and things like that. I do think that the most problematic, pervasive issue is just whether we are prioritizing governmental public health, population health appropriately across the board. Specifically, when thinking about gaps and shortcomings, just from some of the data that we've looked at, I do think that there are shortcomings in public health infrastructure. The foundational capabilities, the things that PHAB accreditation looks at, these business competencies, the business of doing public health. But I also think in many cases with that infrastructure, it is not as resource intensive as you would think. I think there are a lot of opportunities for service and resource sharing, for uniform policy changes. I think that with fairly low investment in time and resources, you could see massive improvements in governmental public health services across the nation. A lot of what are in the foundational areas in many ways kind of take care of themselves, although then we get into things like federal funding, and are we receiving enough funding to actually do these services, which most federal funding goes toward the foundational areas. So that's sort of a different question. But I do think that in terms of system transformation gaps and shortcomings, broadly, it is prioritization for governmental public health and that return on investment. And specifically, it is resource and investment for infrastructure.
Wait, I'm giving just another pause. See if there's any other questions. I'm not seeing other open questions, so I'll give just another moment. I know we are actually at 4:45, so we're at the end of the webinar. That went really fast. So I'm going to start to wrap up. I think we were able to get to all the questions, which is great. So just real quickly as a wrap up, I want to thank you again all for attending. You'll be receiving an email in in the next couple of days that will have, again, a link to the recording as well as a copy of the slides and a link to a short evaluation. In the spirit of continuous quality improvement, please, we encourage you to complete the eval survey. I think Lydia is also going to drop, she did just drop the link in the chat. And then I also want to, again, thank Jason for co-presenting and to everyone who contributed to the blueprint development. This is really just step one of what, again, I see as an organic document, and we'll continue to build on this initial blueprint as time goes on, and again, as new resources are developed and as we learn more. If you have questions, please, again, feel free to reach out to us at phabboard.org. Have a great rest of your day, and thank you again for attending.